Welcome, I'm Amy Scott. I'm one of the nurses here at Los Robles, and today I'm going to take you on a maternity tour. But before we get started, I wanted to start by just talking about a few things that we'd like for you to accomplish before you come to the hospital to have your baby. So first off, we want you to go to the hospital's main website and make sure you click on the icon that says pre-register online. Once you've completed your registration information, then when you're in labor, you can just come straight to the second floor and go to labor and delivery. If you're coming in for a scheduled procedure, then we'll have you stop in at the admitting department on the first floor, and then you'll come up to labor and delivery. A few things you might want to consider before you come to the hospital is making sure that you've also selected a pediatrician, and that's the doctor for your baby. The second thing we want you to do is make sure you have installed your car seat in your car, that it's ready to go for when you're ready to leave the hospital with your infant. Know that you will sign a consent form when you're here at the hospital that says that you have a car seat and it's installed properly in your car and you know how to use it. The other thing that we want you to do before you come to the hospital is make sure that you have some items ready to go in your bag, packed for when you come to labor and delivery. A few of those things you might want to consider are maybe some snacks in your bag, specifically for our partners. Other items you might want to consider are some comfy clothing to change into after you've had your baby, and then an outfit to bring your infant home in after you leave the hospital. And here we have our waiting room on the second floor that services both labor and delivery as well as mom-baby. So if your friends and family are coming to see you and it's just not a good time to have them in the room with you at that moment, they can stay in the waiting room for a little while. There is a coffee machine here as well as a microwave. There's a television so they can watch TV, and there's also a restroom here in the waiting room. And then when it's time for them to come and see you, they can come to your room. Here we have our newborn nursery on labor and delivery. As you'll notice, there are no babies in the nursery at this time. That's because we do rooming in. So your baby stays with you from the time you're born until they leave the hospital. But we do use our nursery for procedures, such as circumcision procedure. And then we also have our nursery open at night from about 11 o'clock at night until 7 o'clock in the morning. And for our families that choose to have their baby go to the nursery for a few hours so they can get some rest, it is available. This is a room on labor and delivery. These rooms are called LDRs. That stands for labor, delivery, and recovery. So when you come to labor and delivery, if you're in labor, you'll make a stop at the nurse's station and they'll let you know what room to come to. If you deliver vaginally, you will labor, deliver, and then recover in a room that looks just like this. These beds are made specifically for our laboring moms. So the bed itself can be made into a chair-like position. The bottom portion of the bed can come down. There's footrests at the bottom of the bed, and then there's also an attachment for a squatting bar for our moms who maybe would like to use some different positions while they're in their labor bed. We also offer birthing balls in the room as well as a peanut ball. So if mom is mobile and she's moving about her room and she wants to utilize those, we have those available here at the hospital. This right here is our partner bed. So it's a couch, but the bottom or the back portion of the couch can lay flat into a bed. And for our partners, we will provide blankets and pillows so that you can rest comfortably at night while mom is staying with us here in labor and delivery. Right here is our stationary fetal monitor. So moms, when you come into your room, you'll notice that the little straps are located on your bed. And so while you're in bed, if you're being monitored, we'll put you on the stationary monitor. We've recently made available the wireless fetal monitor. So if you are mobile through your room or you're wanting to get in the bathroom or the shower, you can also use the wireless monitor. This is a Panda warmer. It's for our infants. So moms, after you have completed 1 hour of skin-to-skin time with your infant, our nursery nurse will come into your room, do an assessment on your infant, take their vital signs, and they like to have them underneath the warmer so they don't get too cold. This is the mom-baby unit, also known as postpartum unit. Once you've finished having your baby in labor and delivery and recovering with them for about 1 to 2 hours, then you move over to a room here on the mom-baby unit. And that's where you'll finish your stay with us. So if you deliver your baby vaginally, you can plan on staying for 2 days. 48 hours is a pretty typical length of stay. If you deliver your baby by cesarean section, plan on staying for 3 days. It may be as long as 4, it just depends on your physician. The restrooms and the rooms on our units have been recently renovated, and this is what one of the bathrooms looks like here on Mom Baby. So there's a shower, and then you'll also notice right next to the toilet there is a shower caddy, and Moms For You will provide everything that you need to take care of yourself after you have your baby. So pads, disposable underwear, sometimes your doctor will order medications to go on your bottom if it's swollen after you have your baby, and so all of those things we'll put in your restroom. So the day after your infant is born, the pediatrician, your baby's doctor, will come to the room like this to do a full head-to-toe assessment on your infant. We'll provide everything that you need to take care of your infant while you're here. So there's diapers, there's wipes, there's a bulb syringe, there's also t-shirts and swaddles. And so you don't need to pack a full suitcase full of things to bring for your infant. Just an outfit to go home in for your baby will be adequate. We'll provide everything else that you need for your infant here.